Good morning, Governor.
Good morning. How are you?
We are great. Thank you so much for joining us.
Thanks for having me.
We've got over 100 of Kentucky nonprofit leaders on the call this morning, and glad to have you with us. Knowing you've got a limited amount of time, we're going to dive right in. We want to first thank you for your incredible communication and leadership during this really incredible time, and we're appreciative that you've got 15 minutes to share with us this morning.
Well, thanks for having me, and let me start the way we always start. We will get through this, and we will get through this together. And one of the reasons we're going to get through this is the leadership of all of you. When none of us would have ever known that we would face something like this, a worldwide pandemic that has turned all of our lives and our economy upside down. We probably could have also not predicted that the most important thing in how we respond was how much we care about each other, our willingness to sacrifice for each other, to even put our own economic security on the line for the lives of other people. But you know who I knew would step up and pass that test is our nonprofit community, because that's the calling that you have answered. And in this time when there are so many needs, while I believe that ultimately it will be temporary, you have been there to answer that call. We talk a lot about the people that we need to appreciate more. You all are on that list. And your steady and calm leadership, making sure that you are doing things very differently than just 3 months ago or less, has been incredibly helpful in making sure that we flatten this curve. And let me say, I believe Kentucky, more so than just about any other state, based on if you look at the states around us, have come together and have flattened that curve, which is truly saving lives. Now, we're not out of the woods yet. When I talk about a test of humanity, there's really 3 parts. The first is sacrifice, which we have been making. The second is patience and planning, which is what we're moving into. And the third is perseverance. So as we're able, as we hopefully start to see decreased cases, right now we're in that plateau, which is a great thing. It means we're not at a peak. But as we start seeing decrease in cases, wanting to plan for and move towards a new normal, but knowing that until we get a vaccine, it is going to be a new normal. Telework is going to become the norm for just about anyone who can. And we just need to make sure that we know that there's still a lot more to come, and that we are resilient, and that we are strong, and we are ready, and that we are also working to meet the needs of the people who are around us. We've gotten to partner with a number of you all in everything from childcare to food banks to so many other services that people need. And you all have been innovative in finding ways to still help people, even though you can't necessarily come face to face with them. I think we've all been challenged on how we continue to protect each other, both our health through social distancing, but also in so many other ways. The other day, not everything I say at 5 is scripted. I know you all can tell that. But when I was thinking about the greatest generation, for us to win, to beat this virus and to come out in a strong position, we're going to have to be the kindest generation. And I think that we are passing that test. Now, just because we're starting to see a plateauing and more data on our testing, doesn't mean that the uncertainty in many ways is ending. And that's what creates a lot of the anxiety and the difficulty. That is fiscal uncertainty. Now, right now, without help from the federal government, Kentucky's state budget is going to be devastated. And that is just about every state. It is every state. I'm on calls with them, pushing for state and local help. We're working very hard on that. We had some comments from a senior senator the other day that are a little concerning, but my hope is that in what they're calling CARES Act 4, that we will have some relief in that. Our ability to get that relief will directly translate towards helping especially those nonprofits that we partner with. What a budget would look like without assistance from The federal government, think about 2008 in the recession without any of that federal assistance, and that's what you're looking at. But I'm still hopeful. We are still working towards it. It's going to cause some problems in our current fiscal year, but my hope is that we'll get the help in this next fiscal year to be where we need to get. We're still also waiting on advice on the CARES Act. It's interesting when you get $800 million, the first part, but you don't know how you're allowed to spend it yet. And so that's supposed to come in tomorrow. And I will tell you that we want to spend it in a way that helps the most people possible, knowing that there are important organizations out there that are anchors in our community. The tough part on the uncertainty is until the federal government tells us how we can spend it, it doesn't really help just to have it. I mean, I've never had $800 million in an account before, so I guess that's nice. But if we don't have the instructions, which are coming, then we're not going to be able to give you a lot of clarity yet. But like everything, the news comes kind of swift and fast in this period of time. So we look forward to getting you more information. So I'll close and open it up to questions. First, thank you for everything you're doing. More now than ever, people need you. They need us. And I hope that you are seeing a level of appreciation that you have never seen. But number two is keep it up. We're going to continue to face tough circumstances, both on the health and on the finances side, but we will get through this. And we are resilient people here in Kentucky. And I believe that we can come out of this hopefully healthy, not only in our physical, mental, and emotional health, but eventually healthy financially. This is something on that side, again, we've never seen, at least in my lifetime, an almost 1, 2, 3 month pause. Mm-hmm. And so we're all hoping the bounce back will happen, and will happen quicker than some predict.
Thank you, Governor. Well, as you know, nonprofits are a resilient and innovative bunch. We are good at that. So I think that's why you're seeing so many folks who are able to rise to the challenge. And I know we've got limited time, so I'm really going to focus on 2 questions. One on, you hit on this, so many organizations partner and contract with the state. And I know you mentioned there are a lot of unknowns. You may, or probably weren't paying that much attention necessarily, but in the last 2 days of the General Assembly, there was a bill that would have extended existing contracts for 90 days. And, as we approach June 30, and a lot of folks have these contracts and there's a lot of anxiety around that, is extending those something you can do via executive order and something that you all could look at? I think there's folks just concerned that as of June 30, they kind of fall off the cliff, and what happens then?
Well, that's something that we're going to have to look at. That's another one of those things amidst this uncertainty. But I hope you all have seen that my commitment is to provide the services to the people of Kentucky that they desperately need. And virtually all the contracts that we're talking about are contracts with the state where you provide those services. We're not going to stop caring for those who need us. We're not going to stop caring for the lost, the lonely, and the left behind. And in the midst of this crisis, it's going to be really hard at different times to rebid contracts. We've extended our Medicaid contracts for some of those reasons. So we'll be taking a look at all of that, but know that we're not going to stop providing those necessary services for people. And I hope that provides you some security, but in the midst of this uncertainty, that's where we are right now.
Right. Well, and I know you've been talking in the last several days about reopening and what that might look like. And, unlike most associations, our members at Kentucky Nonprofit Network are incredibly diverse. They don't all operate in the same way. They all interact with the public in different ways. And you've mentioned, trying to hear from various industries. And again, I'm trying to wrap my head around how we can do that for the sector, knowing that diversity. But can you walk us through, because I think so many organizations are trying to wrap their head around what this would look like for them. What does social distancing look like for them? What does contact tracing? Are they responsible for that? Because getting up and running again, there are costs associated with that. And again, we've got organizations kind of already on the brink. So can you talk through some of what you, in your crystal ball, might see in the coming months, especially as people are thinking about events and things for the summer?
Well, here's where I'd start with your organization. start in your mind at knowing that the future can't look like the past, right? And so the structure that you had in place before can't be the structure that will be in place as we move forward. So in this planning stage, take a look at everything that you do, right? And first, anything that can be done through telework or telehealth, that is one place to start. Because this is not just protecting the clients you serve, it's protecting your employees too. So if you, for instance, have a billing department no longer needs to be on site to do their work. So think first about everybody that can continue to work from home, especially because that decreases your density. Next, think about how your interactions with different people occur and how using your physical location you can provide extra protection for people. That is, no waiting rooms anymore. That's across the board. Now, I'm a person who always disliked waiting rooms in general, but the new waiting room ought to be your car, and how that is handled. The setup when you have to have a person-to-person interaction, the use of a telephone more and more, the ability to authenticate documents without someone bringing them in because the virus can be transmitted through that type of medium as well. We're going to be moving towards a place where everybody in public or at any large place of work is going to need to be wearing masks. Now those are cloth masks, right? And so starting to look for or to encourage your employees to get those, they need to be wearing them to the grocery store right now. Anyways, as we move from kind of the intense social distancing that we've had to a reopening. The state is going to make a very significant investment in contact tracing. What we're going to need help on with any organization, though, is whether it's your HR director or the leader of your organization, knowing where those contacts are in work, especially. Because we're going to have to do it very rapidly. So what the future looks like is somebody comes in symptomatic, and you will need temperature checks for anybody coming in each day. That's going to be something that you can go ahead and work on trying to prepare for now. The goal would be to send them for a test right away, or anybody who's at home feeling sick. Those tests can be achieved through our drive-in and drive-through locations. We're also working on a new way to push these out and to have a center in different regions that people can go to with testing much more widely available. Now, the cost of testing obviously should be borne either through our private healthcare system, through Medicaid, or when necessary, the state directly on top of that. That's going to have to become a new part of our healthcare system. But then you got to be prepared with your staff for 14-day quarantines for those contacts. That's why if you spread people out, if you stagger shifts, having one person test positive doesn't shut you down or shut down your physical location for a period of time. And so really start thinking very creatively about what the new normal looks like, because that new normal is going to exist until there is a vaccine, which they tell me is about a year away. I hope it's closer. I really do. And events, group events, I'd be very wary of right now. You know, we're going to get a little bit of data from states that I believe are moving forward in a way that is not appropriate under CDC guidance and is going to threaten a lot of people out there. I mean, I'm a Democratic governor, but I believe the president's plan, written plan on reopening America is based on science. And the states that are moving ahead aren't following that plan. And we heard from the president yesterday that he thinks one of those states is moving too fast. So meetings, gatherings, you know, into the summer, there may be a 10-person limit that we can get to, which we don't have right now. But we don't anticipate being able to do large events while this virus is still where it is right now. So think virtually, think creatively. I will say that we have more people participating in different virtual telethons or other events right now because we all want something to do.
Yes.
And so think through that even in the summer. My goal is to have us in the best place we can be, especially moving into the fall.
Mm-hmm.
And that's two pieces. Number one, hopefully having the virus run its course while we have reopened, because I really want our kids to be able to go back to school.
Yeah.
I really do. And as a parent of kids, I need to get back to school. I really do.
There are lots of parents who agree with you on that, Governor. Yes.
and then being prepared for a fall spike, which is what's happened in just about every other pandemic, and being able to do everything from the healthcare and the contact tracing and the testing to knock that down. But as you can tell, this is a fluid situation. No one had ever heard of this virus until December 31st, basically. But with your work and with everybody else's work, I mean, we are coming together to defeat something that could have been as deadly as the Spanish flu or other pandemics that have run through the United States. One day, I'll share the initial projections that I had over how many we'd lose, and it's heartbreaking.
Yeah.
And while everyone we lose, it hurts. I mean, I read it every day. We would have lost thousands of more Kentuckians by now than we have because of your work and so many others. So keep it up. Keep doing your best, knowing that this is a time of uncertainty, but listen, we in the state appreciate your work. We'll do everything we can to help, and because we have to get through it, and we're going to get through it together. Thank y'all.
Thank you, Governor. Really appreciate your time today and your commitment to nonprofits and understanding the vital role we play in Kentucky's future and in both our quality of life and economy. Thanks for your leadership.
Absolutely, and I look forward to not just our work in getting through this virus, but the great things we can do for Kentuckians coming out of it, getting healthier, having more opportunity. Those are all things and places we've got to get to where we can get every child in a good routine to have that physically, emotionally, and mentally healthy life.
Absolutely. Thanks again, Governor.
Thank you.
Uh-huh.